Hello, I'm Dr. Philip Blair, and I am a family physician located in Washington State of the United States. And I've been practicing family medicine for over 40 years. And I am also a retired U.S. Army colonel, having served in the military for over 26 years in the capacity of a family physician. I want to talk to you today about post-traumatic stress and cannabidiol, and what you need to know about this. In my experience, cannabidiol has a profound potential to absolutely change the course of therapy and treatment for all of PTSD. Let me tell you about that. First off, I went to the United States Military Academy, graduated in 1972, and I retired from the Army in 1997. I was a combat physician during the first Gulf War, and I've been involved with disease management since the year 2000. Over 3 years ago, I got involved with cannabidiol and learned about its huge potential in treating a broad range of conditions. And since that time, I have helped thousands of patients, and I gave recommendations for specific use of cannabidiol in different clinical situations. I've also done a number of literature searches and found connections with a broad range of conditions that have not been well addressed by current medical practice. One of those is PTSD, and I'd like to relate some of my experience with that. In our country, we've been faced with a number of disasters as well as a number of wars, as for all of the European nations. One example was the World Trade Center attack, which destroyed, of course, 2 buildings, but we are still living with the results of post-traumatic stress disorder as a result of that particular trauma. Thousands of workers who were involved as first responders are continuing to suffer much of the complications of PTSD. In addition, our military is having an increased rate of PTSD, as well as complications such as suicide, the most serious kind that we have. And yet treatments are not ideal. Characteristically, PTSD has a number of different issues that come up. Number one is the re-experiencing and of flashbacks. That traumatic experience replays over and over. In addition, there's a hyperarousal, there's an alertness, and there is the sense that something is going to be happening, or the threat that something will be happening shortly that will threaten their lives or some of the people that are around them. In addition, you have avoidance, where people who suffer with this withdraw. They become isolated. They become fearful of groups of people and many places. Perhaps those places remind them of some of their PTSD experience that led to the onset of this disorder. In addition, they've got those negative thoughts and moods that is associated with depression as well as suicide. Over all of this, you're looking at a fight or flight phenomena where physically the heart is pounding, the blood pressure is rising, they are sweating all over, their eyes are wide. It's often referred to as a 1,000-yard stare for the combat fatigue that we have seen in combat situations. But PTSD is much more than just military or even for first responders. What we see is that with PTSD, it can occur in almost any situation of a traumatic nature. Within police as well as firefighters and, of course, military veterans. But the military, it really represents a minority of the number of people who are experiencing PTSD. From this diagram, you can see that battered women take a role of at least 45% are having the symptoms of that. Abused children, 50% develop PTSD. And raped adults, 36% will have post-traumatic stress disorder as a result of that. So that much, much broader than just the military, although we tend to be focused mostly on the military, it is so pervasive within our population, within the world population, as well as for the wars they experience and the trauma situations such as major attacks. All of these can have a very dismal outlook and potential for so many people. And let's talk about what we can do to help this condition. First off, when we look at PTSD and getting into some of the pathology that's involved, we actually see epigenetic DNA modifications as a result of this trauma. We're not sure how all this works, but we see these changes in the DNA where the areas of inflammation, those cassettes, those cascades of mechanisms in the genes that produce inflammation are excited and they're encouraged. At the same time, the dampening portions of the DNA are reduced, so you're not getting the control that needs to be there. You're seeing within the PTSD climate increases in the inflammatory cytokines from macrophages and other immune cells, the interleukin-6 and interleukin-8s. We see also the increased blood-brain permeability. So there are additional molecules that normally are excluded from the brain circulation are being activated in the brain area of the PTSD victims. So it appears that inflammation along with these adverse experiences is key to much of the lasting effects of PTSD. Above all of this, we're seeing the microglial activation. Those are the cells in the brain and throughout the tissues of the brain that are the macrophage and the immune activators and the structural support for many of the neurons that are there. The current therapy for PTSD is quite broad. There's behavioral therapy, antidepressants, a number of medications, anti-anxiety agents, opioids. Opioids because most of the patients with PTSD also have other disorders and other problems. And there is a fairly high rate of addiction to other substances, including opioids, going along. And opioids are used to help control many of the symptoms that are there. And we're seeing illicit use of cannabis in order to control the PTSD. So I want to refocus now on the endocannabinoid system because it's something that we haven't heard much about. Although it was discovered in 1992, we're just learning many of the details about the endocannabinoid system. And why this is important is because this may be the factor that's controlling and maintaining normal in the body, which is disrupted in PTSD. The endocannabinoid system deals with and controls, modulates the neurologic, the neurotransmitters specifically, the immune system, and the endocrine system. All of these areas are normalized within a functioning and a fully functioning endocannabinoid system. Unfortunately, more and more commonly, we're seeing evidence for disruptions and disturbances in the endocannabinoid system, which is now being called clinical endocannabinoid deficiency syndromes. And it involves not just areas of pain, but it involves areas that we thought we understood, things like migraine headaches, chronic fibromyalgia, or irritable bowel syndrome. All of these have been clearly shown to have disturbances, major disturbances in the endocannabinoid system. And it turns out that PTSD is no different. In the World Trade Center, studies were done on the individuals who were involved, and it was learned that there was quite a bit of disturbance within these individuals looking at PET scans of the brain. They showed increased levels of the CB1 receptors being available but not being activated, with decrease in the number and the amounts of the endocannabinoid substances that would normally bind to the CB1 receptors. In addition with all that, for these chronic states, there was evidence for decreased cortisol as the hormone that is activating much of our fight or flight symptomatology. So combining these three factors, the researchers were able to predict with a 90% certainty someone who had PTSD and was clinically suffering from that condition versus an individual who had trauma or who was completely a healthy individual. So specific characteristics of endocannabinoid deficiency are being seen in PTSD. What can we do about it? What is the therapy for endocannabinoid deficiency of any kind? Cannabidiol could fill that particular role, and the reason is quite profound. A number of preclinical studies have shown an amazing ability for cannabidiol to reduce the fear memory in the brain. It reduces acute fear symptoms and relaxes and calms. And you could see that that is going to involve a decrease in the anxiety and also the hormonal reactions that are going on, which are key to the establishment of PTSD. It blocks reconsolidation. When we think about PTSD in terms of the recurrent thoughts that we have, actually the consolidation or the reconsolidation pathway is one in which that the memory of that traumatic event is repeated time and time again. That is just like a new recording, and a new experience of the same trauma over and over again. Unfortunately, that particular pathway continues on and actually gets reinforced each time one has that experience, that mental experience of going through that particular trauma. At the same time, we have a mechanism within our amygdala that allows us to extinguish, to get rid of bad memories, to wipe them out of our memory for the fear that it engenders. Cannabidiol blocks the reconsolidation of these types of fear memories, and it enhances the extinction of that particular fear memory. This is a superb combination approach that CBD has. In addition, we know that cannabidiol can actually restore the endocannabinoid balance within the brain and other tissues within the body. Furthermore, we know that cannabidiol has been shown to restore a natural hormone balance, so getting the cortisol levels back to a normal level and balance. So the combination of all of these benefits plus the anti-inflammatory effects that CBD offers, because CBD has more anti-inflammatory ability than vitamin C or vitamin E in reducing inflammation and reactive oxygen species. There are several other mechanisms at play with CBD working in PTSD. We see immediate results in using cannabidiol, and we see lasting improvement. That is distinctly different from many of the other therapies that can continue on for months and years and indefinitely. We see reduced drug use and prevention of withdrawal type of symptoms from those drugs, whether they're benzodiazepines, antidepressants, or even opioids. We see prevention after an acute event. By using cannabidiol immediately after a traumatic event, we may be able to prevent the evolution and the development of PTSD by blocking that particular process. And it protects the blood-brain barrier. Remember, I talked about that leaky time period after a traumatic event where inflammatory substances can reach the brain and incite the immune system. Cannabidiol could protect that barrier from the damage and the additional leaking and the resulting inflammation that would continue with that. I had the opportunity to work with a number of veterans who had PTSD. These 9 veterans had different ranges of them. I had them do a questionnaire to go through the process before we started the CBD. And then I had them take the same exam and questions after using the CBD for 3 weeks. It was not a long study. The average improvement was well over 60%, and the side benefits were quite profound, including a relief of pain and discomfort. We went from, in looking at the chart, you went from a extremely difficult situation in 50% of symptoms. They went from over 50% having severe and extreme levels of symptoms to, after using CBD, nobody had extreme levels, and there was continuing lower levels down to none at all with the CBD group. Quite profound. The additional side benefits include an improved ability to communicate with their family, and an ability to work fully and be fully employed, and to take on additional responsibilities, become purposeful and getting things done as well. A resolution of the pain and the depression all occurring at the same time. These results continued on and have not abated. The improvements have been quite profound, with a whole different perspective for the individuals involved after using the cannabidiol. I have had a number of other soldiers that I've worked with respect to PTSD. Let me tell you a story about Joe. He was a Korean War veteran. I met him because his family called me in to talk to them and design some treatment that would be helpful for him, because he was totally withdrawn, watching television, being absolutely immobile, and very little communication. But once a month, he would go to a local military veterans hospital, and he would spend half day and return. But he would never talk about his experiences. I had the family start using cannabidiol, and after using for about a week, his behavior dramatically changed. He started being much more communicative. He started becoming active. He was doing many more things. He was walking and taking part in activities. And most profoundly, he was telling the stories of his traumatic experiences as a soldier in the Korean War, when his unit, his squad, was called upon to take out an enemy machine gun nest. Unfortunately, he was the only survivor of that experience, and he was wounded, but he made it back to the friendly lines. He was able now, where he had been completely withdrawn and non-communicative, he was able now to tell me amazing details, even including his doctor's name, the number and the designation of the hospital that he went to, his closest friends. And he was expressing all these experiences and all of those feelings that he had that was associated with it. He profoundly told me that before we had started with the cannabidiol, he felt that he was merely a piece of broccoli, a vegetable, watching television, that he had no function or purpose or ability to communicate or to be active. But after using CBD, it changed his whole life. And he dedicated himself to doing his memoirs about his Korean War experience. Now, Kate was a different case. She was one of the 9 soldiers I was telling you about. She was an airman working with the Air Force with the combat mission group. Soldiers and airmen were coming back, and pilots were coming back injured by artillery or by being hit from their actions in Iraq. And she saw the death and destruction that was associated with that, along with some of the airmen being maimed and injured. That was very profound for her. She left the service and she went into therapy for PTSD, had quite a bit of counseling. But after going through that counseling and having a great deal of difficulty, she still lingered with many of the symptoms and was not getting better. After using the cannabidiol for 3 weeks, she told me that this was not her first experience with PTSD. In fact, she revealed to me that she had been assaulted and molested as a 7-year-old child, and that she'd carried that with her for decades and tried to suppress it and keep it down. But only now was she able to really express those feelings, to talk about that, and to let those types of feelings resolve. I think this is a great example of how injuries and abuse in women can translate into PTSD experiences in wartime, as well as the sensitivity that women have, particularly for endocannabinoid disturbances. There are also profound CBD side benefits. This is unlike THC that has the psychoactive portion of it. What we see with cannabidiol is an enhanced memory and an improvement in mental processing. Not a dulling down, but an enhancement and an improvement in function. There's task accomplishment and task orientation. There's pain relief at the same time, along with anti-inflammatory and immune modulation to improve and correct for inflammatory conditions that are happening. In addition to all this, it's improving sleep without actually putting you directly to sleep. In dosing for PTSD with cannabidiol, I have found that there are many different sources of product, but the ideal source is coming from industrial hemp. It has very small amounts of THC, and in PTSD, THC may not be helpful and may continue the situation rather than resolving and allowing these patients to go into remission. There are many different product forms for CBD that are available as either capsules or concentrates or tinctures, or a product that is more bioavailable, as in and called liposomes. And the liposomes are small molecules that are put into vesicles wrapped with a phosphate protein, and they become water soluble. This has improved bioavailability and is better absorbed, and it can have as much as 5 times the potency of regular tincture CBD. Any of these forms can be effective for PTSD. It does not require any special form, including the possibility of vaporizing and using CBD in a vaporized form. The suggested serving sizes for PTSD, what I've seen in my experience with the liposomal variety, has been 10 to 15 milligrams compared to tinctures of perhaps 60 milligrams of the CBD. A vaporizing formula could be as little as 1 milligram, although I prefer to have the vaporizing in combination with one of the other forms for the maximum benefits of the side benefits that occur with CBD. When you're dosing with CBD, everybody is so different because it doesn't make a difference about what size they are. It's not a matter of how big or having to do with the distribution of the body. I consider that people have different levels of disruptions of their endocannabinoid system, and by as a result, they respond differently to the cannabidiol in terms of whatever dosing it is. So some people may require high doses, and other people will require just very modest doses in order to make huge differences in the symptoms that they're experiencing. You can be guided by the symptoms very, very carefully. They will help you decide whether to increase or decrease the doses that are being used. I like to assess after the first day and the first week. I think it's really important to talk with these people and look closely for the people with whatever symptoms they have, to look at the changes they're having in terms of relaxation of the facial muscles, the change in their speech pattern, a clarity, a deepening of their voice, maybe an octave and lowering it, as well as a more forceful voice and a stronger voice. There's other mannerisms can be improved as well. And watching the patient can be very helpful in deciding that they are, determining whether they are making progress and what the dosage might be. So let me summarize what we've gone over here. Number one is PTSD is very common, both in our soldiers, but also in the civilian population everywhere. Women are particularly sensitive. There's endocannabinoid dysfunction in many of the disorders, particularly PTSD, but many of the other problems that we face on a regular basis. CBD is highly effective in so many of these conditions, especially for post-traumatic stress, but also inflammatory conditions, and neurodegenerative conditions as well. CBD restores the endocannabinoid system and reestablishes homeostasis for a normal and healthy development and evolution. It's legal in all of our US states and in 22 countries around the world. Cannabidiol could really change the face of modern medicine if it's used properly and vigorously within the population for a broad range of conditions because of its valuable properties and its lack of significant adverse effects. I've taken the references for this talk and what I've talked about today, and I've put them into the reference folder that I have listed here. We have other sources that you can look to find additional information, including the realm of caring, which offers an international call-in center to talk about using cannabinoids for a broad range of conditions, including PTSD. I'd love to hear from you and about your experiences, and I'd love to answer any questions that you have. I'll certainly open myself up to take your questions at the first opportunity. And I appreciate the opportunity to speak with you on this very important subject at the dawn of hopefully a terrific experience and a potential for your countries using cannabidiol. Thank you very much for listening.